Thank you very much, everybody, this afternoon. I'd also like to thank Jerry and Paddy for inviting me here to talk a little bit about tobacco harm reduction, or harm reduction, in Ireland. That's my disclosure statement. Okay, so our smoking rate, I hope I'm not too loud, our smoking rate in Ireland at the moment is 19% daily smokers. We have quite a low rate of e-cigarette use or vapor product use compared to our nearest neighbours in the UK. Our government has a WHO-mandated end goal, and I'm going to use those terms in inverted commas, of reaching a smoking prevalence rate of less than 5% by 2025, which represents about 50,000 Irish smokers switching or quitting per year until the year 2025, and quite how the Irish government expects to do that without an aggressive harm reduction policy, frankly, is beyond me. You'll see that vaping is largely, almost exclusively confined to current or ex-smokers. Vapor product use by non-smokers is less than 1%. So, what are some of the barriers to harm reduction in Ireland? Well, a lot of the misinformation and misreading of the evidence that was laid down before, during and slightly after the drafting of the EU Tobacco Products Directive has had a really lasting effect in Ireland. In 2014, our Health Service Executive banned the use of e-cigarette products on all of their hospitals and campuses, even in private cars. We had a little bit of positivity in 2015 when our then Health Minister, who has just this week become our Prime Minister, decided, based on evidence and very correctly, not to include vaping in the indoor workplace smoking ban. And this year, I'll talk about the HICWA HTA in a second. We had 2 GPs that specialise in addiction bring a motion of acknowledgement with their doctors' union, the IMO, the Irish Medical Organisation in Ireland, who stopped short of endorsement, but they went as far as acknowledgement. And I'll admit, I had the trigger reaction to that as well, like, what? But in Ireland, acknowledgement was a massive, massive step. So thank you to those 2 GPs. We also had the EU TPD come into force this year, which is, in my opinion, more of a negative and more of a barrier to greater uptake of these products than it will be a positive, although from an industry perspective it does have positives as well. But all in all, in Ireland, you won't find any public policy acknowledgement, endorsement, plan, framework, or acceptance of harm reduction principles. So the Health Information and Quality Authority carried out this health technology assessment on, they were asked to do so by the Department of Health. HICWA, the nearest kind of equivalent body that I can think of that people might be aware of is NICE in the UK, even though it's not quite exactly like that, but it's quite similar. It made the headlines everywhere. And I think there was probably an expectation at the time that Ireland was going to follow the real pragmatic example of the UK and have vaping officially endorsed. But, and I am going to sound quite negative about the HICWA HTA, but I feel I have to be, because they were only looking at the use of safer nicotine products in the context of a 12-week cessation programme, the same as NRT. So harm reduction was never in the scope of the HTA. We had 10 comments highlighted in the summary of responses, which we were absolutely delighted with, because it's the first time that I think we had ever been listened to about what the products are, what the barriers to uptake are, as in, you need to tell smokers that these products are safer. and that they have a right to hear that information, and withholding that information is unethical. So we were really pleased about that. But we also kind of tried to make the point that you cannot simply or solely treat these products as a quit aid. You have to look at use outside of a clinical setting and outside of this medical train that they seem to want to stay on. And the media messaging was, to my mind personally, really badly mishandled. That last sentence there is a comment that a vapor in his kind of mid to late 50s said to me outside a bar that night when the HICWA was released. And that's what he took from all the media messaging about this assessment during the day. HICWA says we shouldn't be using these, or we should stop using these. So what are the people who theoretically should be embracing harm reduction or safer nicotine products? What are they actually saying about them? Well, all of these comments, and I'm sorry that the end is cut off, but normalisation is the last one, by the way. All of these comments were made to HICWA by tobacco control researchers, pharmacy unions who supply pharmaceutical NRT products, NGOs who work in smoking cessation, medical doctors, university hospitals, dental hospitals, our national cancer charity, and national cancer charity coalitions. And these were all their kind of list of things of why safer nicotine products should not be endorsed by the Irish government. And I'm sure the second one down, I'm sure Professor Mendelsohn will enlighten us as to why that isn't a very good idea. And then I've taken these ones separately. So these 4 separately, because I wanted to highlight them just to illustrate how bad this information is in Ireland. These were the comments made by a publicly and government and pharmaceutical company funded NGO and lobby group, patient lobby group, who get government funding for a helpline for people with asthma. And as we know from Professor Ricardo Pelosa's research, these safer nicotine products have huge potential in people with asthma and COPD who smoke. So I wanted to kind of highlight that to illustrate the disconnect that's going on here with the research and the public information. I may have misquoted that, the name of the new clinical guidance that HICWA HTA will feed into, but I don't think that really matters. So when we talk about communication failure, I think it was a communication failure in 3 acts, because this is from January. This is when it was opened for public consultation. This is the day it was released, and then this is a couple of days later. So the scope of the HTA wasn't adequately communicated to the public, so harm reduction was never going to be in there. In some instances, smokers are being told that they need to wait up to 5 years for these Irish studies. I haven't been able to find out who's doing those studies or why, on who, with what methodologies, we don't know. And the entire focus was so narrow, treating them like a medicine. I mean, what does a smoker actually hear when they see those messages? And when we talk about mixed messaging, one of the biggest barriers to better understanding of uptake and just understanding of reduced risk products in general is that in Ireland we're still not separating the nicotine from the smoke. So this mantra of nicotine being harmful that smokers hear, when that's continued through to vapor products, for instance, are smokers more likely or less likely to try them if this is what they see constantly about nicotine? I mean, if it's banned, it must be banned because it's harmful, right? So this is the poster that our health service executive is mandated to put up in hospitals and clinics. This Dublin hotel will, if you vape on the balcony, will charge you €100 for a deep clean, whatever that means. It sounds nice. And then, of course, we have the EU mandated cigarette-like warnings on vapor products. So what effect does all this have on public perception? Well, in the most recent EU barometer figures, we've gone up 11% in misperception of how harmful these products are. And I personally think that rise is alarming, but of course, because I work for the independent industry, I'm not allowed to advertise these products. And smokers aren't going to be aware, you know, and I think Deborah talked about it in the last section. You know, this idea of misperception, I mean, if they're not told by anybody in Ireland, apart from ourselves in industry, then how are smokers going to know? And there's a reluctance in both the public health community, in the government Department of Health, in the anti-smoking NGO sector. There's a real reluctance to kind of step outside company line, but thankfully that is changing. And I don't know what happened to my slide here, because I had this beautifully formatted. But but we are starting to see shifting approaches. So what the leadership is saying of these organisations is different to what practitioners on the ground is saying. The public statements that people are making aren't always the same as what they're saying in private. And interestingly enough, and fittingly enough for the theme of this conference this year, is that Irish drug policy conversations are really fastly and really kind of pragmatically coming from that use, abuse, abstinence kind of conversation to harm reduction. But, I mean, speaking from somebody who's looking at that from the outside, it's a pity they wouldn't kind of loop back a bit and include nicotine when they're doing that. So when I ask my members in the association, like, what are smokers actually talking about when they come into vape shops, when they want to try a vapor product? And one of the top things that they care about is all these myths about nicotine. And I'm being told to wrap up now. So because we're not doing so much now, we are at a crossroads of how we go forward with a real long-term goal of what we want these safer products to be. I think it should be the column in the middle. That's just personally. I don't think we should go over to the column on the left. And I think we should be really careful about the column on the right and think about what the public health role should be and shouldn't be when we're dealing with these products. To my mind, the public health and government role should be just providing the information, the relative risk information, making sure that the smokers have access to safer products, making sure that vapers then also have access to the products by limiting regulation. I'm going to keep talking. And then give people the opportunity to do it. I'm just going to keep talking. So we also need to take a step back and kind of learn from our mistakes. And what we did was we thought about what it should be, and we tried to fit these safer nicotine products into whatever kind of box our own ideology came from, when what we should have done is start at the end and use a start at the beginning or start at the end approach and look at what it actually is. So are we understanding how users use the products? Do we understand the independent vaping industry? Have we ever spoke to the independent vaping industry? Are we doing the most useful research that we can, apart from the safety of the product, to get the answers that we need to get more smokers switching to them? I don't think we're doing that in Ireland. Are we crossing stakeholder approaches and using users and independent industry in research enough? We're not doing that in Ireland. And if I could recommend one thing finally, it's have a read of Sharon Cox and Sarah Jake's paper on how we should be thinking about these products. And I'll stop now. Thank you.